Hi, my name is Dr. Smith. Today, my aim is to make sure everyone is informed and aware of the risks of contracting a disease in Cambodia. I understand that you have the Urban Challenge later this year.
What exactly is a disease?
So, a disease is a condition or illness that prevents the body or organs in the body from operating correctly. There are many different factors that can result in disease. They include environmental factors, lifestyle choices, and infections caused by microscopic organisms. Immunity can be defined as resistance to a disease.
What are microorganisms?
Microorganisms can be defined as single-celled beings that reside in a group of cells. They are helpful and harmful microorganisms. Pathogens are the ones that have the potential of transmitting diseases. They aim to survive and multiply. Pathogens are usually spread directly or indirectly, meaning either through coming in contact with someone with the disease or involves coming in contact with contaminated droplets, air, animals, food, or water.
What types of microorganisms are there?
Firstly, there are pathogenic bacterium. They are unicellular organisms that either depend on a host to survive or are free-living beings. To cause disease, bacteria has to enter the body. Once the microorganism has been reproduced, toxins are released. Secondly, there are viruses. Much smaller than bacteria, viruses rely on others to reproduce. They invade our living cells and use their chemical machinery to stay alive and replicate itself. Left unchecked, the virus will cause the death of the host cell. Viruses will spread to nearby cells and begin the process again. This ability to mutate and change in each infected person allows viruses to avoid being killed and treated. Let's move on to fungi. They are living organisms. Like animals, humans, and most bacteria, all fungi get their energy by absorbing organic substances. Although most types are only pathogenic to plants, some may be harmful to humans. Fungi reproduce by means of spores. By coming into contact with these spores, we are putting ourselves at risk of toxic compounds entering our body. Non-contagious diseases are not transmitted from person to person.
What does our body do to prevent us from getting sick?
All living organisms are subject to disease. We all have hormones, organs, tissues, and white blood cells devoted to taking care of the risk of infection. Together, these body parts form the immune system. The first line of defense against disease and illness comprise of both chemical and physical barriers. Some are saliva, skin, tears, stomach acid, white blood cells, and healthy bacteria in the gut and intestines.
What else can we do to stay healthy?
Sometimes the immune system can only do so much. To consistently stay healthy and prevent disease, vaccines are recommended. Refer to Figure 2 in your booklet. They consist of weakened or dead pathogens or viruses. When you receive a vaccine, the body recognizes the germ as foreign. It responds by producing special proteins or antibodies. These antibodies neutralize the germ. If we encounter this specific type of pathogen again, the body remembers how to react, and as a result, we gain immunity. Look across the page at Figure 3. Although not as beneficial as vaccines, good hygiene does significantly prevent the risk of illness. Doing simple things such as washing hands, body, and hair, brushing teeth regularly, covering the mouth and nose when coughing or sneezing, will mean that it is less likely that germs and parasites will reproduce and grow in and around the body. Cuts, burns, and abrasions must be covered to prevent germs and parasites from entering the body.
What can we catch in Cambodia?
In third world countries, you are more likely to contract diseases due to poor infrastructure, lack of access to clean water, and other environmental aspects. In Cambodia, you're at risk of receiving the following. Refer to Figure 4. A deadly bacterial illness, usually a result of ingesting polluted water. Sufferers may experience diarrhea, vomiting, stomach pain, fever, and severe dehydration. cholera is highly contagious. It is possible to reduce the risk of catching the disease by washing hands regularly before and after meals and making sure the drinking water is clean. In small amounts, the effects are mild. However, in developing countries, like Cambodia, where clean water is limited, the disease can be deadly, and anyone who is at risk of catching it, the complications, renal failure, low blood sugar, and dehydration may lead to shock and ultimately death. When diagnosed, doctors and medical professionals will often prescribe antibiotics and rehydration. Those who survive the cholera normally never receive it again. Secondly, salmonella, a digestive tract infection commonly associated with typhoid fever, gastro, and other food poisonings. The bacteria can be found in any raw poultry, fish, eggs, meat, unpasteurized milk, or other foods contaminated by salmonella. Establishment of safe food practices decrease the likelihood of infection, appearing 12 to 72 hours after coming in contact with the bacteria. The symptoms, diarrhea, nausea, vomiting, and stomach pain, normally last for 3 to 7 days if mild. There are little to no long-term effects. Thirdly, malaria. It is a parasitic disease, meaning any illness that is caused by an organism that lives on the host to survive. To Figure 6. This disease is diagnosed using a blood test. Malaria is transmitted by the bite of a mosquito that is infected by the parasite. A person remains infected by the disease for as long as they have it in their bloodstream. Person-to-person transmission does not occur. Those who have been infected by malaria often endure hot and cold flashes, nausea, confusion, and stomach pains. Tourists, such as yourself, are more at risk as you have had no previous exposure. To limit the chances of getting bitten, protective clothing is advised. Doctors normally recommend prescription antibiotics as treatment. If the parasite is resistant to drugs, anemia, comas, and lifelong disabilities may follow. When mild, it takes around a fortnight to fully recover from the disease. Finally, schistosomiasis, Figure 7. A disease caused by parasitic worms, commonly found in contaminated freshwater where snails have been infected by schistosomes reside. These snails are infected when someone defecates or urinates in the water. As Cambodia is a third world country, the rate of polluted bodies of water would be quite high. Those with the condition normally experience a rash, coughing, high fever, and aches within about 1 month of receiving the disease. Once inside the body, the parasite lays eggs. Depending on the location of these eggs, seizures, paralyzation, and brain damage may occur. The parasitic worms may cause pregnant women to have miscarriages or stillbirths. The parasite can kill. To avoid contracting the disease, don't swim in fresh water and make sure drinking water is boiled before ingestion. Medication has been trialed to treat schistosomiasis. However, the effectiveness of these drugs have not yet been determined.
How do these diseases affect life in Cambodia?
Due to the nature and prevalence of these particular diseases, society in Cambodia has changed and will most likely continue to change after these illnesses have been eradicated. Poor hygiene and sanitation has significant financial costs with major effects on the achievement of the Cambodian government's socio-economic goals. Minimum exposure to disease and environmental risk factors indirectly contributes to reducing poverty because many environmentally mediated diseases cause lost earnings. If disease, injury, or death eliminates the only one source of income for a family, this leads to increased poverty and disease for the entire family. Without safe hygiene practices taught in schools, many children are forced to miss out on their education, ultimately resulting in a higher risk of poverty, lack of medical knowledge, and a higher chance of starvation. As education can promote a sustainable agricultural industry, improve hunger, and achieve food security. Lastly, Cambodia's tourism industry is severely affected by diseases like cholera, malaria, and dengue fever. A reduction in the amount of people coming into Cambodia and the corresponding loss of money only adds to the damage sustained by the ongoing health situation. It's crazy to think that the tiny little microorganisms can have such an effect on a large country like Cambodia. Thank you. By now, I should hope that you know enough about the risks of contracting a disease in a third world country and are also aware of how to react should the situation arise.